Welcome back to the channel, guys. If it's your first time here, thank you so much for clicking on this video. Welcome to our channel where we post daily Medicare videos. Consider hitting the subscribe button and the notification bell so you can be updated every single time that we make a video here on our channel. But thank you guys for clicking on it. Let's get right into it.
What is Medicare? Medicare is the federal healthcare system for individuals over age 65 and certain individuals with disabilities. Who is eligible for Medicare? So to become eligible, there's one requirement. You or your spouse have to have worked a minimum of 10 years or 40 quarters according to Medicare guidelines. Now, there's these things called qualifying events. And so a qualifying event, long story short, is an event that makes you eligible for Medicare. It's a life change. And so the most common one is turning 65. So if you turn 65, you can get on to Medicare at that time. Another one is coming off of or having disability income for 2 or more years. You can get on to Medicare at that time. Another one that's common, and some of you guys on the call might be working past 65, coming off of a group plan or an employer plan after you've worked past 65, that is a qualifying event that allows you to get on a Medicare at any time. And then the last one is if you get diagnosed with end-stage renal disease, you can get on a Medicare at that time as well. So when do you enroll? We get this question a lot as well. So if you're already drawing Social Security, you're going to automatically be enrolled 3 months before you turn 65. So you're going to get your red, white, and blue Medicare card in the mail 3 months before your 65th birthday. Now, if you're not drawing Social Security, you actually have to do an extra steps because you have to manually enroll. And so you can do that during what they call your initial enrollment period. And so during this initial enrollment period, it's a 7-month window that Medicare says, hey, you can enroll into Medicare at this time and get no penalties. And so that's 3 months before you turn 65, your 65th birth month, and then 3 months after you turn 65. How do you enroll into Medicare? So we get this question a lot as well. So number one, you can call the Medicare hotline number at 1-800-Medicare. Number two, you can call the Social Security hotline number. Or if you value your time, you don't want to wait on hold for 2 hours, you can go to ssa.gov and create yourself a Social Security account to enroll into Medicare. Or you can call us. We do it for hundreds of people every year, but it takes about 10 minutes. So I'm sure by now, if you're looking into Medicare, I'm sure you've heard all types of people saying, hey, there's Medicare, those Medicare penalties, they're permanent. They never go away. You got to watch out for them like a hawk. Well, that's true. But if you take a step back, there's really only two penalties that you need to avoid. The first one is what they call the Part B late enrollment penalty. And you get this penalty by not enrolling into Part B of Medicare during that initial enrollment period, that 7-month window. The second penalty that you can get is the Part D late enrollment penalty. So you can get this penalty by not enrolling into drug coverage when your Part B starts. And so when that Part B starts, you want to have your drug coverage in place so you're not going to get any penalties along the way. Now, this is another popular question. So when does my Medicare begin? So if your birthday is between the 2nd and the 31st of the month, your Medicare is actually going to go into effect on the 1st of your birth month. So if you're born on January 2nd, your Medicare is actually going to start January 1st. Now, if your birthday is on the 1st of the month, your Medicare is actually going to go into effect on the 1st of the month prior to your birth month. So if your birthday was January 1st, your Medicare is actually going to start December 1st. Retiree group health coverage. So I'm aware that you guys may be working past 65, and that's certainly okay. You do not have to take out Medicare at 65 if two things are happening. Number one, You have to be actively employed, you or your spouse. Second box that you got to check is you have to have coverage through that employer. You have to have health insurance through that company. If you don't, you're gonna get penalized if you bypass Medicare. And so those two things have to be happening. You have to still be working, you or your spouse, and you have to have group coverage through that employer. Now, if one of those two things isn't happening, you're going to get penalized once you take Medicare out. And if you found yourself getting a penalty, this is how you can calculate it. So it's a permanent penalty, and it's 10% for each 12-month period that you were eligible for Part B, but didn't take it. And so it's about $17 to $18 a month in penalties, and that will last the rest of your life. Now, group versus Medicare, I did want to throw this slide in here just to let you know if you're contemplating, should I take my group or should I keep my group plan or should I take out Medicare at 65? There's a lot of things to consider. You need to consider your premium. So how much does it cost? Your deductible, your co-insurance percentage, your max out of pocket, your co-pays, your prescription costs. So much goes into it that you need to evaluate because oftentimes we'll find that Medicare is either more affordable or it's better coverage. And if you need help doing that, let us know. We'd be more than happy to do it. We do it for hundreds of people every year. And it's simple for us. We just compare them. We'll show you and say, hey, Medicare might make more sense, or you stay under your group plan for a couple years might make more sense. Options for spouses. So I definitely wanted to put this slide in here just to let you know that if you're currently covering your spouse through your employer coverage or whatever coverage that you might have, and they're losing that because you're getting on a Medicare, they have options. They don't have to go without health insurance. There's a lot of great options if they're losing coverage due to you getting on to Medicare. Some of those are the marketplace through healthcare.gov. There's Christian health share programs, there's short-term medical plans. We represent all those and we'd be more than happy to help you. But just to let you know, there are options for your spouse and your kids. Now, this is what I like to call the meat and potatoes of the whole thing. So if you don't understand this part, it's going to be hard to understand your options once we go over them. So definitely pay attention to this part. So I like to call this the foundation of Medicare. It's hospital part A and medical part B. So this is what you actually enroll into 3 months before you turn 65. And if you've ever heard anyone throw around the word original Medicare or traditional Medicare, this is what they're talking about, Part A and Part B. Now, what are some of the costs that come along with original Medicare or Part A and Part B? So Part A, which is your hospital coverage, typically doesn't cost anything per month to have because you worked 40 quarters or 10 years. Part B, your medical coverage, typically will range, but this year in 2024, it's $174.70 a month. Now, if you're a higher income earner, you could actually have to pay more. So let's take a look at this chart here. So to read this, and we're not going to go over all of it, but this is how you factor your Part B premium. So I do want to point out one thing. Medicare always looks back 2 years when determining your Part B premium. And so what this kind of looks like is if you're getting on a Medicare in 2024, they're actually going to look at your 2022 income. If you're getting on a Medicare in 2025, they're going to look at your 2023 income. And so they always look back 2 years. And so let's just take a look at one column here. So say that you're filing individual tax return and your income is less than or equal to $103,000 a year. Well, that means you're not going to pay any adjustment. You're going to just pay the $174.70 for your Part B. Well, let's say that you make $103,000 up to $129,000. you're going to pay $69.90 more, totaling to $244.60. So you can see the more money that you make, the more money that you're going to have to pay for your Part B. And we'll just stop it there, but you can kind of see that chart and kind of where you fall from it and see what your Part B is going to be. Now, those two together, Part A and Part B, only cover you at 80%. That is a crucial information to know. A lot of people that are turning 65, they get on a Medicare, they get the Part A and Part B card, and they think that's all that they need to do, which I don't blame them because it's confusing, but that could not be further from the truth. It only covers you at 80%. And so take, for example, maybe say you only had Part A and Part B, and you got diagnosed with cancer, and you had $1 million worth of cancer bills, you would be responsible for $200,000 or 20% of that bill if you only had Part A and Part B. Now, I don't put that slide in here to scare you. It's just you got to be educated on this and know that you need more. And so now let's talk about that's the foundation of Medicare. Now let's talk about your two options of covering that 20% gap. Now, the first option that we're going to focus on is you keeping original Medicare, so Part A and Part B, but taking out a Medicare supplement with a separate prescription drug plan. So what is a Medicare supplement plan? Medicare supplement is also referred to as a Medigap plan and is extra insurance that you can buy from a private health insurance company to cover the 20% that original Medicare does not cover. So exactly like it sounds, it covers the gaps in A and B. Now, Medicare, they like their letters. They've got Part A, Part B, Part C, Part D. They didn't fail us on the Medicare supplement side either, or the Medigap side. So there's a bunch of different types of Medicare plan or Medicare supplement plans, and they're all categorized by letters. Now, for the call, and to make it simple, we're only going to focus on two of them. First one we're going to look at is a Medicare Supplement Plan G. Second one is a Medicare Supplement Plan N. These are the two most popular plans that you can get on Medicare Supplement wise. So let's take a look first at Medicare Supplement Plan G. So say that you took one out. This is how you can expect it to work and cover your bills. So Part A and Part B are first going to pay 80% of your bills. And then the Medicare Supplement Plan G is going to come in and pick up that other 20% entirely, minus a one-time a year, $240 yearly deductible. So, if you pay your premium for that Supplement Plan G each month and then your deductible, you have 100% coverage no matter what you do. Now, you can also see down below there that the Part B 15% excess charge is also green. I'm sure you're wondering, what the heck does that even mean? And so the Part B 15% excess charge is essentially Medicare releases a book every year of pre-approved copays for certain things that you get done, certain services. Well, certain doctors or surgeons or hospitals are allowed to charge 15% more than what Medicare says that they're allowed to charge. And so on the Plan G, they also pick that up. So when I say 100%, it's 100% coverage. Now let's take a look at a Medicare Supplement Plan N. So the Medicare Supplement Plan N is going to be similar to a Medicare Supplement Plan G on the fact of your Part A and your Part B are going to pick up 80% of the bills. Your Medicare Supplement Plan N is going to come in and pick up the other 20% minus that deductible. And so it's identical so far. But the biggest difference is that 15% excess charge, you're responsible for if you have a Medicare Supplement Plan N. Now, I know that 15% doesn't sound like a lot, but when you have a cancer doctor doing that or a surgeon doing that, where the bills are pretty expensive, that 15% can mean a whole lot more in those situations. And so we always say just be careful. Plan G and Plan N are both good. I believe Plan G is just a little bit more competitive and a little bit more popular. Now let's take a look. So this is what a turning 65 male would pay for a Plan G in the average state. Now I say average very strongly because not every state is going to have these different types of prices. Certain places like New York or Florida or some of the other ones, they're going to have more expensive plans. You may see a double or even a triple of this amount. But for the average state, this is what the Plan G's cost for a turning 65 male. Here's a female turning 65 and taking out a Medicare Supplement Plan G. And I do want to point out that these figures here are in addition to the Part B premium, that $174.70 that you pay for your Part B. Now let's take a look. This is a turning 65 male taking out a Medicare Supplement Plan in. This is the average cost, in addition to the $174.70 that you pay for Medicare Part B. And here's a female turning 65 taking out a Plan in. You guys can see that you're a little bit cheaper for whatever reason. Might be a little bit smarter too, but you guys are a little bit cheaper than men turning 65. So there are some things that you're going to want to know about both options, Plan N and Plan G, that these are going to be true for all Medicare supplements. So all Medicare supplement, Plan G, Plan N, doesn't matter, with every company pays the exact same. They work the exact same, they cover the exact same things. So every Plan G with every company is going to be the same. Every Plan N with every company is going to be the same because Medicare, they handle what these plans cover. And then all these different insurance companies get to decide how much they charge for them. So you want to focus on two things. One, you want to focus on price. How much does it actually cost to have the plan? And then secondly, you want to focus on the average rate increase because all these different carriers get to decide how much they lower or raise their rates each year. It's also important to know that all Medicare supplement plans are what they call non-network plans, meaning you can go to any doctor, any facility in the country that accepts Medicare. So if you travel a lot in retirement, Medicare supplement might be the best option for you. Lastly, all Medicare supplement plans do not include any drug coverage either. You do have to get a separate one of those. And so that leads us into our next slide. So Medicare prescription drug plans are separate plans that you can purchase to go alongside your Medicare supplement. Now, typically these cost between $0 and $15 a month. However, if you're on a bunch of expensive medications, that premium could differ a little bit. It could be higher. And the average person pays about $0 to $15 a month. Now, just because you pay a premium for your drug plan does not mean that all your medications will be free. You could still have a copay when picking up some of your medications. It's also, I can't express this enough, it is crucial to do your research on the drug plans because they all have different deductibles. They all cover medications differently. They all have different pharmacies that are preferred. And so you definitely want to do your research on these. And we can be a great assistance with that and checking all your meds and your pharmacies and making sure you get on the best plan. But take this for example. So say that this is just a hypothetical drug plan breakdown. Say that you did your research, you came to our webinar, we helped you get on the best plan for your medications, and these are the four that you fill regularly. And you went to a preferred in-network pharmacy, All you're going to pay is $7.10 for all four of those medications each month. Well, now let's say you did a little bit of planning, but not a whole lot of planning, a lot of research. Same four medications, but you went to a standard in-network pharmacy. Same four are $28.60 a month. Well, now let's say that you're the person that flies by the seat of your pants. You didn't do any research whatsoever, and you got onto a plan. It covers some of your meds. It doesn't cover other ones. Same four medications, went to an out-of-network pharmacy. The same four medications that cost $7 a month now cost you $234 a month because you didn't do your research. And so I don't say that to scare you, but I say that to be careful and do your research. We help people every single day get onto these types of plans. So we've seen a thing or two and we know what to prepare for. So if you need help, feel free to reach out. Now that is your first option, Medicare supplement with a prescription drug plan. Now let's take a look at your second option. And before the question arises, you cannot have both. You have to choose one or the other. And so your second option couldn't be more opposite. It's what they call a Medicare Advantage plan. And what it does is it essentially takes your Part A and your Part B and combines it with drug coverage, typically, to form Medicare Advantage. And so what is a Medicare Advantage plan? Medicare Advantage is also referred to as a Part C plan and is ran by private insurance companies approved by and under contract with Medicare. Now, this is what you can expect if you take out a Medicare Advantage plan. Typically, most of them aren't going to have any type of premium, so they're not going to cost anything per month to have. But you will have copays when you get things done. So when you get certain services done, you're going to pay a copay. You're also going to have certain doctor and hospital networks that you have to stay within. So it's not like the supplement where you can go to any doctor in the country. There will be networks, but they've done a lot with broadening them. A lot of the companies are going to a national network. A lot of the companies have just giant networks where you don't have to really worry too much about going out of network, but you will have networks. There's also extra benefits built in at no extra cost. So you're typically going to have dental coverage included, vision, hearing coverage, and over-the-counter coverage at no extra cost. And then they're also going to have drug coverage built in at no extra cost. And then what makes these so competitive is a lot of them have what they call a maximum out of pocket. So that essentially means that you cannot spend more than that dollar amount, the maximum out of pocket, in a calendar year from January through December. So if it's $3,000, that means you can't go over that $3,000 for the year. Now, the Medicare Advantage is very regulated. There's a lot of rules. So we can't have the actual carrier names on here when we're discussing copays. But these are similar to what you would see on the market. And so you can see down the list here that some of the copays differ on the different types of Medicare Advantage plans. And so I won't bore you with reading through all those, but you can kind of see the difference. One gives more for dental, one doesn't. One gives more for vision, one doesn't. One has a $3,000 max out of pocket for the year. One has a $6,000 max out of pocket. And so I tell everybody, you want to look at the copays too if you're considering Medicare Advantage, because it seems like some of them nickel and dime you a little bit more than others. And so you want to definitely do your research on that part. So what are the costs that come with Medicare Advantage? Just like I said, there's no cost and there's no additional cost. And so whatever you pay for Part A will be typically free. But Part B, whatever you pay for Part B, if it's the $174.70, or if you pay more due to your income, that's what you pay. There's no additional premium. Some important things that you are going to want to know. So each Medicare Advantage plan has different premiums and costs for services. So some might cost less, some might cost more for certain procedures. And then they also cover medications differently on every plan. So it is so crucial to do your research on the drug portion part as well with Medicare Advantage. And then there's two different types of doctor networks when it comes to Medicare Advantage. And so the first one is what they call a PPO, stands for Preferred Provider Organization. And basically what that means is you can go in network totally fine. And if you go out of network, you're still covered, but you may have to pay higher costs. But it does give you the flexibility of being out of network. An HMO, a health maintenance organization doctor network for Medicare Advantage, works similar, but if you go in network, you're totally fine. If you go out of network, you're out of luck. You don't have any coverage outside of your network. And so either one you pick, you definitely still want to stay in network as much as possible to save the most amount of money. And here are some of the Medicare Advantage carriers. So you've got Aetna, United Healthcare, Humana, Anthem, Blue Cross Blue Shield, Cigna, and WellCare. So we represent all of those and several other carriers. Now, there's these things called Medicare savings programs. And so these are the updated numbers for 2024. So this, if you fall into these categories, it may be of your best interest to look into them. So if you're an individual or married and you make your monthly income is less than these numbers right here, and your resource limit, checking account, savings accounts, investments, are lower than these amounts here, you could actually potentially qualify to get your Part B premium paid for. So that $174.70 wouldn't be taken out of your check, and your prescription cost would be reduced as well. And so if you're even close to those numbers, I would consider looking into it because it could save you quite a bit of money each year. And then there's what they call dual eligible plans as well. So if you have both Medicare and Medicaid, these plans are designed for you. And so typically what they do is they turn all your copays to $0 copays for all approved services. And then they typically offer increased additional benefit amounts for dental, vision, hearing coverage, over-the-counter coverage, and even grocery utility allowance, all sorts of goodies. And so if you have both Medicare and Medicaid, those are great options for you. And just a recap here, I know we went over a lot of valuable information, but it's a lot of information and it can be confusing. So I just want to recap. So your first option of covering the gaps in Part A and Part B is Medicare Supplement. You're typically going to have a premium each month, but you're not going to have any copays. You're just going to pay that deductible once a year and you got 100% coverage. You're going to have no doctor network, so it gives you the most amount of freedom. And then you've got to get that separate drug plan. Flip side, your second option is Medicare Advantage. You're not going to have any type of premium typically, but you're going to pay as you go. You're going to pay as you use your plan. But you're going to have most everything included. So drug coverage included, extra benefits included, dental, vision, hearing. And then you've also got the doctor network. So you can't go to everybody, but you do have a big network of doctors.
Thank you guys so much for watching the video. If you're still here, that means you like the content on this channel. So I would highly encourage you to go click that subscribe button and the notification bell so you don't ever miss another video that we put out. Guys, thank you so much for watching this video, and I'll see you in the next one.